First tonight, as we start a new week, it is also the start of National Infertility Awareness Week. Thanks for joining us at 5:30. I'm Frank Wiley.
And I'm Courtney Robinson. Good to see you. The World Health Organization estimates that about 1 in 6 people are impacted by infertility. 10 Tampa Bay's Malik Rankin speaks with a local mother who is sharing her story tonight to stop the stigma.
For sweet moments like these, it took Sarah Durante years and multiple rounds of IVF to become a mama to baby Miles.
So I was actually diagnosed with ovarian cancer in 2014, and they found it by a positive pregnancy test.
Starting with chemo, that was the beginning of a long journey of treatments, hospital visits, and tests to see if it was possible for Durante to have a baby.
It was heartbreaking.
After 2 rounds of intrauterine insemination, 7 rounds of in vitro fertilization, and genetic testings,
We went through many embryo transfers without success. We ended up really having to pull out all the stops.
Durante was nearing the end of her rope. She decided one more round.
Mentally, I was exhausted. It's such a long drive every day to the clinic, so many shots. You have to stop your life.
Now, 2 months postpartum, she'll tell you it was well worth it.
And we finally got our positive pregnancy test, and it was unreal.
With the last embryo.
The last embryo, the very last try.
Specialists say oftentimes people delay getting fertility treatment, but that is something doctors have noticed is changing. Here at Shady Grove Fertility, the specialists here tell me the number of patients seeking infertility treatments have grown over the decades, yet accessibility still is an obstacle.
There was a time maybe 15 or 20 years ago where there were maybe 50,000 IVF cycles a year in the United States. It's probably now closer to 250,000 cycles a year, so there's been huge growth.
Dr. Plosker says people often hesitate to see a specialist because of cost, but it's better to make a decision after you know your options.
Go see a fertility physician, because a fertility practice is going to be set up to be able to explore benefits, give you a full comprehensive answer to all these questions.
And if you need a little encouragement, this new mom is proof.
It can happen, even if you think that it will not. So just keep trying, keep looking for answers, and advocate for yourself.
Malik Rankin, 10 Tampa Bay.
Frank and I were saying, we remember those moments.
Oh, yeah.
Congratulations to the Durantes on Miles, and thank you for sharing to encourage others. According to the National Infertility Association, only 19 states have mandates that require insurance carriers to provide infertility benefits. Florida is not one of those states.